26. A client is chronically short of breath and yet has normal lung ventilation, clear lungs, and an arterial oxygen saturation SO2 96% or better. The client most likely has A. Poor peripheral perfusion. B. A possible hematologic problem. C. A psychosomatic disorder. D. Left-sided heart failure.
Answer: B. SO2 is the degree to which hemoglobin is saturated with oxygen. It doesn't indicate the client's overall Hgb adequacy. Thus, an individual with a subnormal Hgb level could have normal SO2 and still be short of breath. In this case, the nurse could assume that the client has a hematologic problem. Poor peripheral perfusion would cause subnormal SO2. There isn't enough data to assume that the client's problem is psychosomatic. If the problem were left-sided heart failure, the client would exhibit pulmonary crackles.
Question 27. For a client in Addisonian crisis, it would be very risky for a nurse to administer A. Potassium chloride. B. Normal saline solution. C. Hydrocortisone. D. Fludrocortisone.
Answer: Addisonian crisis results in hyperkalemia, therefore, administering potassium chloride is contraindicated. Because the client will be hyponatremic, normal saline solution is indicated. Hydrocortisone and fludrocortisone are both useful in replacing deficient adrenal cortex hormones.
Question 28. The nurse is reviewing the laboratory report of a client who underwent a bone marrow biopsy. The finding that would most strongly support a diagnosis of acute leukemia is the existence of a large number of immature A. lymphocytes. B. thrombocytes. C. reticulocytes. D. leukocytes.
Answer: D. Leukemia is manifested by an abnormal overpopulation of immature leukocytes in the bone marrow.
Question 29. The nurse is performing wound care on a foot ulcer in a client with type 1 diabetes mellitus. Which technique demonstrates surgical asepsis? A. Putting on sterile gloves then opening a container of sterile saline. B. Cleaning the wound with a circular motion, moving from outer circles toward the center. C. Changing the sterile field after sterile water is spilled on it. D. Placing a sterile dressing 1/2 centimeters from the edge of the sterile field.
Answer: C. A sterile field is considered contaminated when it becomes wet. Moisture can act as a wick, allowing microorganisms to contaminate the field. The outside of containers, such as sterile saline bottles, aren't sterile. The containers should be opened before sterile gloves are put on and the solution poured over the sterile dressings placed in a sterile basin. Wounds should be cleaned from the most contaminated area to the least contaminated area, for example, from the center outward. The outer inch of a sterile field shouldn't be considered sterile.
Question 30. A client with a forceful, pounding heartbeat is diagnosed with mitral valve prolapse. This client should avoid which of the following? A. High volumes of fluid intake. B. Aerobic exercise programs. C. Caffeine-containing products. D. Foods rich in protein.
Answer: C. Caffeine is a stimulant, which can exacerbate palpitations and should be avoided by a client with symptomatic mitral valve prolapse. High fluid intake helps maintain adequate preload and cardiac output. Aerobic exercise helps in increase cardiac output and decrease heart rate. Protein-rich foods aren't restricted, but high-calorie foods are.
Question 31. A client with a history of hypertension is diagnosed with primary hyperaldosteronism. This diagnosis indicates that the client's hypertension is caused by excessive hormone secretion from which organ? A. Adrenal cortex. B. Pancreas. C. Adrenal medulla. D. Parathyroid.
Answer. Excessive of aldosterone in the adrenal cortex is responsible for the client's hypertension. This hormone acts on the renal tubule, where it promotes reabsorption of sodium and excretion of potassium and hydrogen ions. The pancreas mainly secretes hormones involved in fuel metabolism. The adrenal medulla secretes the catecholamines epinephrine and norepinephrine. The parathyroids secrete parathyroid hormone.
Question 32. A client has a medical history of rheumatic fever, type 1 insulin-dependent diabetes mellitus, hypertension, pernicious anemia, and appendectomy. She's admitted to the hospital and undergoes mitral valve replacement surgery. After discharge, the client is scheduled for a tooth extraction. Which history finding is a major risk factor for infective endocarditis? A. Appendectomy. B. Pernicious anemia. C. Diabetes mellitus. D. Valve replacement.
Answer. D. Heart valve prosthesis, such as a mitral valve replacement, is a major risk factor for infective endocarditis. Other risk factors include a history of heart disease, especially mitral valve prolapse, chronic debilitating disease, for drug abuse, and immunosuppression. Although diabetes mellitus may predispose a person to cardiovascular disease, it isn't a major risk factor for infective endocarditis, nor is an appendectomy or pernicious anemia.
Question 33. A 62-years-old client diagnosed with pyelonephritis and possible septicemia has had 5 urinary tract infections over the past 2 years. She's fatigued from lack of sleep, urinates frequently, even during the night, and has lost weight recently. Test revealed the following: sodium level 152 mcl, osmolarity 340 mOS/ml, glucose level 125 mg per deciliter, and potassium level 3.8 mcl. Which of the following nursing diagnosis is most appropriate for this client? A. Deficient fluid volume related to inability to conserve water. B. Imbalanced nutrition, less than body requirements related to hypermetabolic state. C. Deficient fluid volume related to osmotic diuresis induced by hypernatremia. D. Imbalanced nutrition, less than body requirements related to catabolic effects of insulin deficiency.
Answer. The client has signs and symptoms of diabetes insipidus, probably caused by the failure of her renal tubules to respond to antidiuretic hormone as a consequence of pyelonephritis. The hypernatremia is secondary to her water loss. Imbalanced nutrition related to hypometabolic state or catabolic effect of insulin deficiency is an inappropriate nursing diagnosis for the client.
Question 34. A 20-year-old woman has just been diagnosed with Crohn's disease. She has lost 10 pounds, 4.5 kilograms, and has cramps and occasional diarrhea. The nurse should include which of the following when doing a nutritional assessment? A. Let the client eat as desired during the hospitalization. B. Weight the client daily. C. Ask the client to list what she eats during a typical day. D. Place the client on INO status and draw blood for electrolyte levels.
Answer. C. When performing a nutritional assessment, one of the first things the nurse should do is to assess what the client typically eats. The client shouldn't be permitted to eat as desired. Weighing the client daily, placing her on iron dose status, and drawing blood to determine electrolyte level aren't part of a nutritional assessment.
Question 35. When instructions should be included in the discharge teaching plan for a client after thyroidectomy for Graves' disease? A. Keep an accurate record of intake and output. B. Use nasal desmopressin acetate DDAVP. C. Be sure to get regulate follow-up care. D. Be sure to exercise to improve cardiovascular fitness.
Answer. C. Regular follow-up care for the client with Graves' disease is critical because most cases eventually result in hypothyroidism. Annual thyroid-stimulating hormone tests and the client's ability to recognize signs and symptoms of thyroid dysfunction will help detect thyroid abnormalities early. Intake and output is important for clients with fluid and electrolyte imbalances but not thyroid disorders. DAP is used to treat diabetes insipidus. While exercise to improve cardiovascular fitness is important, for this client the importance of regular follow-up is most critical.
Question 36. A client comes to the emergency department with chest pain, dyspnea, and an irregular heartbeat. An electrocardiogram shows a heart rate of 110 beats minute sinus tachycardia with frequent premature ventricular contractions. Shortly after admission, the client has ventricular tachycardia and becomes unresponsive. After successful resuscitation, the client is taken to the intensive care unit. Which nursing diagnosis is appropriate at this time? A. Deficient knowledge related to interventions used to treat acute illness. B. Impaired physical mobility related to complete bed rest. C. Social isolation related to restricted visiting hours in the intensive care unit. D. Anxiety related to the threat of death.
Answer. D. Anxiety related to the threat of death is an appropriate nursing diagnosis because the client's anxiety can adversely affect heart rate and rhythm by stimulating the autonomic nervous system. Also, because the client required resuscitation, the threat of death is a real and immediate concern. Unless anxiety is dealt with first, the client's emotional state will impede learning. Client teaching should be limited to clear, concise explanations that reduce anxiety and promote cooperation. An anxious client has difficulty learning, so the deficient knowledge would continue despite attempts teaching. Impaired physical mobility and social isolation are necessitated by the client's critical condition, therefore, they aren't considered problems warranting nursing diagnoses.
Question 37. A client is admitted to the healthcare facility with active tuberculosis. The nurse should include which intervention in the plan of care? A. Putting on a mask when entering the client's room. B. Instructing the client to wear a mask at all times. C. Wearing a gown and gloves when providing direct care. D. Keeping the door to the client's room open to observe the client.
Answer. Because tuberculosis is transmitted by droplet nuclei from the respiratory tract, the nurse should put on a mask when entering the client's room. Having the client wear a mask at all the times would hinder sputum expectoration and make the mask moist from respirations. If no contact with the client's blood or body fluids is anticipated, the nurse need not wear a gown or gloves when providing direct care. A client with tuberculosis should be in a room with laminar airflow, and the door should be closed at all times.
Question 38. The nurse is caring for a client who underwent a subtotal gastrectomy 24 hours earlier. The client has a nasogastric NG tube. The nurse should A. Apply suction to the NG tube every hour. B. Clamp the NG tube if the client complains of nausea. C. Irrigate the NG tube gently with normal saline solution. D. Reposition the NG tube if pulled out.
Answer. C. The nurse can gently irrigate the tube but must take care not to reposition it. Repositioning can cause bleeding. Suction should be applied continuously, not every hour. The NG tube shouldn't be clamped postoperatively because secretions and gas will accumulate, stressing the suture line.
Question 39. Which statement about fluid replacement is accurate for a client with hyperosmolar hyperglycemic noncotic syndrome (HHNS)? A. Administer 2 to 3 L of 4 fluid rapidly. B. Administer 6 L of 4 fluid over the first 24 hours. C. Administer a dextrose solution containing normal saline solution. D. Administer 4 fluid slowly to prevent circulatory overload and collapse.
Answer. Regardless of the client's medical history, rapid fluid resuscitation is critical for maintaining cardiovascular integrity. Profound intravascular depletion requires aggressive fluid replacement. A typical fluid resuscitation protocol is 6 liters of fluid over the first 12 hours, with more fluid to follow over the next 24 hours. Various fluids can be used, depending on the degree of hypovolemia. Commonly prescribed fluids include dextran in case of hypovolemic shock, isotonic normal saline solution and, when the client is stabilized, hypotonic half normal saline solution.
Question 40. Which of the following is an adverse reaction to glipizide glucotrol? A. Headache. B. Constipation. C. Hypotension. D. Photosensitivity.
Answer. D-glipizide may cause adverse skin reactions, such as pruritus, and photosensitivity. It doesn't cause headache, constipation, or hypertension.
Question 41. The nurse is caring for 4 clients on a step-down intensive care unit. The client at the highest risk for developing nosocomial pneumonia is the one who A. has a respiratory infection. B. is intubated and on a ventilator. C. has pleural chest tubes. D. is receiving feedings through a jejunostomy tube.
Answer. B. When clients are on mechanical ventilation, the artificial airway impairs the gag and cough reflexes that help keep organisms out of the lower respiratory tract. The artificial airway also prevents the upper respiratory system from humidifying and heating air to enhance mucociliary clearance. Manipulations of the artificial airway sometimes allow secretions into the lower airways. With standard procedures, the other choices wouldn't be at high risk.
Question 42. The nurse is teaching a client with chronic bronchitis about breathing exercises. Which of the following should the nurse include in the teaching? A. Make inhalation longer than exhalation. B. Exhale through an open mouth. C. Use diaphragmatic breathing. D. Use chest breathing.
Answer. C. In chronic bronchitis, the diaphragmatic is flat and weak. Diaphragmatic breathing helps to strengthen the diaphragm and maximizes ventilation. Exhalation should be longer than inhalation to prevent collapse of the bronchioles. The client with chronic bronchitis should exhale through pursed lips to prolong exhalation, keep the bronchioles from collapsing, and prevent air trapping. Diaphragmatic breathing, not chest breathing, increases lung expansion.
Question 43. A client is admitted to the hospital with an exacerbation of her chronic systemic lupus erythematosus SLE. She gets angry when her call bell isn't answered immediately. The most appropriate response to her would be A. You seem angry. Would you like to talk about it? B. Calm down. You know that stress will make your symptoms worse. C. Would you like to talk about the problem with the nursing supervisor? D. I can see you're angry. I'll come back when you've calmed down.
Answer. Verbalizing the observed behavior is a therapeutic communication technique in which the nurse acknowledges what the client is feeling. Offering to listen to the client express her anger can help the nurse and the client understand its cause and begin to deal with it. Although stress can exacerbate the symptoms of SLE, telling the client to calm down doesn't acknowledge her feelings. Offering to get the nursing supervisor also doesn't acknowledge the client's feelings. Ignoring the client's feelings suggests that the nurse has no interest in what the client has said.
Question 44. On a routine visit to the physician, a client with chronic arterial occlusive disease reports stopping smoking after 34 years. To relieve symptoms of intermittent claudication, a condition associated with chronic arterial occlusive disease, the nurse should recommend which additional measure? A. Taking daily walks. B. Engaging in anaerobic exercise. C. Reducing daily fat intake to less than 45% of total calories. D. Avoiding foods that increase levels of high-density lipoproteins HDLs.
Answer. A daily walks relieve symptoms of intermittent claudication, although the exact mechanism is unclear. Anaerobic exercise may exacerbate these symptoms. Clients with chronic arterial occlusive disease must reduce daily fat intake to 30% or less of total calories. The client should limit dietary cholesterol because hyperlipidemia is associated with atherosclerosis, a known cause of arterial occlusive disease. However, HDLs have the lowest cholesterol concentration, so this client should eat foods that raise HDL levels.
Question 45. A physician orders gastric decompression for a client with small bowel obstruction. The nurse should plan for the suction to be A. Low pressure and intermittent. B. Low pressure and continuous. C. High pressure and continuous. D. High pressure and intermittent.
Answer. A gastric decompression is typically low pressure and intermittent. High pressure and continuous gastric suctioning predisposes the gastric mucosa to injury and ulceration.
Question 46. Which nursing diagnosis is most appropriate for an elderly client with osteoarthritis? A. Risk for injury. B. Impaired urinary elimination. C. Ineffective breathing pattern. D. Imbalanced nutrition, less than body requirements.
Answer. In osteoarthritis, stiffness is common in large, weight-bearing joints such as the hips. This joint stiffness alters functional ability and range of motion, placing the client at risk for falling and injury. Therefore, client safety is in jeopardy. Osteoporosis doesn't affect urinary elimination, breathing, or nutrition.
Question 47. Parathyroid hormone PTH has which effects on the kidney? A. Stimulation of calcium reabsorption and phosphate excretion. B. Stimulation of phosphate reabsorption and calcium excretion. C. Increased absorption of AD and excretion of AD. D. Increased absorption of AD and excretion of AD.
Answer. A PTH stimulates the kidneys to reabsorb calcium and excrete phosphate and convert VD to its active form, 1,25-dihydroxyvitamin D. PTH doesn't have a role in the metabolism of VT.
Question 48. A visiting nurse is performing home assessment for a 59-year-old man recently discharged after hip replacement surgery. Which home assessment finding warrants health promotion teaching from the nurse? A. A bathroom with grab bars for the tub and toilet. B. Items stored in the kitchen so that reaching up and bending down aren't necessary. C. Many small, unsecured area rugs. D. Sufficient stairwell lighting, with switches to the top and bottom of the stairs.
Answer. C. The presence of unsecured area rugs poses a hazard in all homes, particularly in one with a resident at high risk for falls.
Question 49. A client with autoimmune thrombocytopenia and a platelet count of 800/L develops epistaxis and melanoma. Treatment with corticosteroids and immunoglobulins has been unsuccessful, and the physician recommends a splenectomy. The client states, "I don't need surgery, this will go away on its own." In considering her response to the client, the nurse must depend on the ethical principle of A. Beneficence, B. Autonomy, C. Advocacy, D. Justice.
Answer. B. Autonomy ascribes the right of the individual to make his own decisions. In this case, the client is capable of making his own decision and the nurse should support his autonomy. Beneficence and justice aren't the principles that directly relate to the situation. Advocacy is the nurse's role in supporting the principle of autonomy.
Question 50. Which of the following is the most critical intervention needed for a client with myxedema coma? A. Administering an oral dose of levothyroxine synthroid. B. Warming the client with a warming blanket. C. Measuring and recording accurate intake and output. D. Maintaining a patent airway.
Answer. D. Because respirations are depressed in myxedema coma, maintaining a patent airway is the most critical nursing intervention. Ventilatory support is usually needed. Thyroid replacement will be administered for. Although myxedema coma is associated with severe hypothermia, a warming blanket shouldn't be used because it may cause vasodilation and shock. Gradual warming blankets would be appropriate. Intake and output are very important but aren't critical interventions at this time.